Welcome to Healthcare Bias, Costs, and Financial Planning. We're going to talk about healthcare bias, the basics. I'm Pamela D Wilson, caregiving advocate, expert, and speaker. And in this program today, we will be talking about healthcare bias. If you have not been a caregiver for a long time, you may not have yet run into healthcare bias. It happens with healthcare providers in the system, and believe it or not, it happens because of biases that we as the family caregiver and others in our family possess. So let's get started. I'm going to take myself off camera. We will go through the normal housekeeping tips. So, as you know, I use the term elderly parent or elderly parents. You can substitute this term with whoever you provide care for. The outline in this module is in the course materials for the program. Do print the slide handouts. If you have not done that, stop this video, stop this webinar, print out the handout so that you can take notes and write down questions. The ellipses on the slide, I put them there purposely so that you follow along with me and learn from the program. Let's talk about the objectives of this section. At the end of healthcare bias, costs, and planning, you should be able to differentiate between day-to-day care and complicated medical decisions in the context of healthcare bias that can prevent treatment. You should also be able to distinguish between the emotional and the hard costs of caring for elderly parents. In this particular section, Healthcare Bias, the Basics, you should be able to identify how age-related beliefs can prevent us and our elderly parents from being proactive about health. You should also be able to describe how family caregiver and practitioner bias affects medical care for elderly parents with memory loss and depression. My educational programs for caregivers and aging adults are the result of my real-life experience over the course of over 20 years in advocating for care for my clients. This part about healthcare bias is based on multiple true stories of my clients who were diagnosed with dementia and my struggle to get the healthcare system to do their job, to provide care. It is essential for you as a caregiver and for your family members and elderly parents to realize that the healthcare system looks differently at providing treatment for the elderly. Young people are seen as young with full lives ahead of them. Older people are seen as the opposite. Bias and ageism exist. Not everyone has a care-forward attitude, which we talk about, which is my belief that age should not define care or ability. In the prior sections, I touched a little on advocating with a healthcare system that might be rushed and doesn't seem to care, maybe doesn't have enough people in their system to help you. In this section, we will go into detail about how this happens and what you can do about it. Getting what you want. My experience, and this is verified by industry experts and research, confirms that the healthcare industry is biased against care for older adults, especially those with dementia. Physical therapy is an area where you will face challenges with providers and maybe with your elderly parent who may have difficulty participating in physical therapy. One example from my experience is providing physical rehabilitation, which is also called physical therapy, for older adults with dementia, specifically in the area of recovering from a hip fracture. I use hip fractures because it is a common event in older adults, not limited to those who have dementia. If you want the physical ability of your elderly parent to return to a prior level, or to be at a level where you as the caregiver can continue to provide care, physical abilities and physical participation are non-negotiable areas. Caregivers tell me that their elderly parents become physically weak. Requiring physical assistance to stand or to get out of bed can result in having to place a parent in a nursing home. It may be the only option. This is the state of care situations where elderly parents have become so physically weak. There is so much that can be done to prevent this if you are aware, noticing the small changes, and if you are proactive. A simple example for yourself is look at your physical abilities today. Is your body stronger or weaker than 10 or 20 years ago? Age-related muscle loss is called sarcopenia. You'll hear that term, it's medical speak. After we hit the age of 30, we lose as much as 3 to 5% of our muscle strength per decade, so every 10 years. Muscle strength is highly connected to activities of daily living and physical function that help elderly parents remain independent and at home, and that allow caregivers to continue to provide care. Let's talk about practitioner bias. My belief is that all older adults with or without dementia deserve dignity, medical care, and empathy from healthcare practitioners. Unconscious bias exists. It's the idea of placing people with dementia in a category of people who will not get better. We all have unconscious bias about different things in our lives, but with this in the medical system, it means that your elderly parent will have less effort put into their care, less attention giving to them unless you speak up. Healthcare practitioners who are physicians, physician assistants, physical therapists, and others may be unconsciously biased against supporting care for older adults with dementia. Physical therapy falls into this bias because it's believed to be a useless effort, a futile effort, because of a belief that people with memory loss cannot learn new skills. It's not that they are learning new skills, it is that they may have to relearn skills that they were able to do if there is a long lag between daily effort. Many elderly with dementia can return to prior activities if those activities are reinstated fairly quickly after an accident. Days, weeks matter. Delays are deadly. Delays mean that elderly parents with dementia who experience hip fractures or other physical issues forget how to walk. They forget how to perform those daily activities that we do every day without even thinking. Failure to thrive. This is a medical speak term that you may hear in relationship to your elderly parent or someone else. Mention of failure to thrive, FTT, and the progression of the disease process is common with older people. If you hear failure to thrive, perk up your ears. These statements mean that your doctor may be dismissing care and treatment options because he feels that your elderly parent has no opportunity to improve. There is a podcast out there. It is called Warning Signs for Helping Elderly Parents, and also another Caring Generation series called Managing Activities of Daily Living. Both of these offer in-depth information related to failure to thrive, serious health declines in your elderly parents. The information can be very helpful. Take the step, seek it out. If you're working with a physician who doesn't seem interested in supporting the care of your elderly parent, it's time to find a new doctor or to become a stronger advocate. Being a stronger advocate means that you show up at the doctor's office with written questions and written requests instead of waiting for the doctor to be more proactive and make suggestions. This is something that you control. Old age beliefs. These beliefs in the healthcare industry include the idea, again, that persons with dementia are unable to follow directions and that this is going to result in poor health outcomes or just your elderly parent getting worse. As we will discuss, physicians are quick to discontinue medications. They believe that these have no benefit to treat dementia because they don't understand all of the benefits. All physicians are not experts in dementia. A medication is discontinued, all of a sudden, the physical abilities of your elderly parent take a drastic change for the worse, confirming only too late that those discontinued medications were beneficial. My experience as a healthcare advocate committed to the care of older adults with dementia contradicts the beliefs of many healthcare industry providers because I have lived in the world of providing care for clients with dementia for more than 20 years. Options exist, hope exists. Giving up is not an option unless your elderly parent tells you they want to give up or they don't want treatment. The end of life is going to happen. We are all going to die, but until then, I always say, take it one day at a time. The insensitive healthcare system. Family caregivers many times can feel helpless at the hands of a healthcare system where providers aren't forthcoming with recommendations for care. Geriatrics, elder care, and dementia are true specialties. It's not practical for every provider to have expertise in this area. This is why it's important for you to ask the question about expertise with anyone you're working with. Ask the question about expertise when recommendations are made. You simply say, what is your expertise in treating the elderly, in treating people with dementia, people with this condition? Put the provider on the spot. Ask the question so that you know if you are working with a person who has the skills to help you. Not everyone does. I recall so many conversations with multiple physicians who had the nerve to tell me, why even operate? He or she is old. They have dementia. They'll die anyway. Oh, pneumonia? He's lived a long life. Let him go rather than providing antibiotics. My response, because I knew the wishes of my client and I was the legally responsible party, was always treat my client. That's what my client wants. There were times, and it will be no different for you, that I had to explain the role of me as a medical power of attorney or as a guardian to a physician. There will be times when you have to explain that you're the caregiver, or you're the power of attorney, or you're the guardian. My response to doctors who said, oh, no treatment, let him go, was always, I'm the one who's legally responsible. I have to explain to the judge in the courtroom why you denied treatment that my client wanted and why my client died. So, unless you want to join me in court, please do what I'm asking. This is part of the do as I say, not as I do. As caregivers, we can serve as an example for our elderly parents in areas where we make suggestions or ideas for improvement. You might remember your parents saying to you when you were younger, do as I say, not as I do. This is relevant in caregiving situations and in life when we want elderly parents to participate in care, but we may be unwilling to follow the recommendations that we are giving out. The opportunity to change life and health for the better exists through the experience of learning to care for elderly parents. If you take an active role in researching the what and the why of care issues, use this opportunity to do as you say when you make recommendations and help elderly parents. So let's summarize what we talked about. Experiencing healthcare bias, it can be shocking for family members, especially if you've never had that experience before. My goal is to increase awareness of the subject so that you or an elderly parent aren't led down the path of decision-making that you would have not normally followed. Doctors can be intimidating. Stand up for what you believe is right. Advocate for the care you want and need by becoming more educated and engaged in care. I want to talk a little bit about how we as caregivers perceive our lives and how we perceive the lives of elderly parents. There is research that exists that cautions us, that says, if by the age of 10 or 12, we have not witnessed our parents engage in healthy eating habits, exercise, well-being, that we may not bring those ideas into our own lives. I can say that I was different and I was fortunate in that area because my parents didn't. back when I was growing up, there was so little talk about healthy aging, healthy nutrition, the benefits of exercise. It wasn't talked about 20, 30, 40 years ago when we were all growing up. But what changed that for me was watching my elderly parents, especially my mother, go through a lot of health issues, heart disease, smoking. She was overweight. She was sick from the time I was in my teens until she died. That experience changed my life. It led me to embrace health, to embrace nutrition, well-being, exercise, all of that. Exercise for caregivers, and really for anyone of any age, has so many positive benefits. And like I asked during the slideshow, how have your abilities changed in the last 10, 20 years? Are you stronger or weaker? Do you do less or do you do more? It happens to all of us without even really noticing. Things we could do before we can't do today. It also happens to our elderly parents, which is why it's important to look into physical activity, look into walking, look into getting out in nature, which is a stress relief for elderly parents and for caregivers. So thank you for joining me for this section on healthcare bias, the basics. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. I will see you in the next webinar.